Hey everyone, it's Dr. David here from El Paso Manual Physical Therapy, and welcome to this week's live stream. I'm sorry. We're going to cover the top 7 questions about how to use a knee sleeve or a knee brace for bone-on-bone knee arthritis. This is a live talk right now, so if you're catching us on the replay and you have any questions that you didn't get to ask, just drop them in the comments. We'll get back to them as fast as we can. And for those of you joining us live, thank you so much. Please type hello in the chat, say something in the chat. Let us know where you're from as well so that I can make sure that you're hearing me. All right, so let's get to it, guys. The number one question we get about how to use a knee sleeve for a bone-on-bone knee arthritis is, should I use a knee sleeve with hinges or without hinges? And if you don't know what I'm talking about, let me show you a brace here that I've got. This one, you can't see it. I can't take them out. They've remade this brace where you can't take it out. But right in here, it's got this hard brace in there, this hard bracket. And it's got double hinges. You can't see them, but it's got a hinge here, another hinge here, so that this brace bends right there. And it's got that brace on both sides. So I get this question all the time. Should I get this kind of brace or the sleeve, the one that doesn't have this hard part, this hinge part, and you just slide it on like a sleeve? And for bone-on-bone knee arthritis, my initial recommendation is just to get a basic sleeve, which is good news because they're cheaper than these braces. They're easier to get on, easier to wash and clean. But when you would go get a hinged brace like this is if you've also got a ligament problem on top of your bone-on-bone knee arthritis situation. So if you've got like a history of an ACL tear that hasn't been repaired, or some other ligament tear or ligament injury like an MCL or LCL injury, if you've ever had those kinds of injuries and you've been to the doctor for it, you'll probably know that you have it. But that's a ligament laxity. And when you have a ligament laxity, you want to use a bracketed brace like this for stability, because those ligaments are critical in giving you stability. And if you've got injuries to them, then you've got to get stability from somewhere else. And an external brace like this is a great option. Now, if you don't have a ligament problem, then great for you. It's going to be even easier to move forward in your knee arthritis problem. So go get a sleeved brace if you're looking to get a brace. I got some comments here. I'm so sorry. Oh, you put your name, Asanula. Hi, Asanula. I'm not sure where you're from. Sorry about your knee cracking and popping sound. That sounds like it could be knee arthritis for sure. Thanks for joining us live on here. So going back to the knee braces, I've got a great video and I've linked it in the description below. It covers how to choose a knee brace. I actually take you to the store with me shopping because there's an overwhelming amount of knee braces at the store. And I go through all the braces there and which one is right for a meniscus problem, for arthritis, for ligaments and all that. And then I've also got linked in the description down here some knee braces that we like that are available on Amazon for you to purchase if you choose to get a brace right now. So let's go to number 2 here. The second question I get is, should I wear a knee brace or a knee sleeve while exercising, during exercise? And the answer to this is, it really depends on how you feel. There isn't a hard and fast rule on yes, you should wear it, or no, you should not wear it. Again, if you've got a ligament problem, you should be wearing a bracketed knee brace virtually all the time except for sleeping. But for knee arthritis, it's up to you. If you feel more comfortable, if you feel better during and right after using a knee brace, then go for it. Use a knee brace. It's a natural alternative. Doesn't put any chemicals in your body. There's no, invasive stuff to wear a knee brace. You're putting it on the outside of your body. So it's a good option if it helps you for exercise. Now, there are people that have pain or increased discomfort, or it changes the way their foot or their ankle works when they wear the knee brace, because there's no perfect knee brace for anybody. I've never met anybody that says this is the best knee brace ever. I could wear this all the time. Everybody complains about wearing a knee brace. They're always like, this thing slides up and down. It itches. It rubs me the wrong way. These straps are uncomfortable. There's all kinds of complaints with them. So it's really up to you if you choose to wear it while you exercise. Hey, Sherry from Montreal. Nice to see you. Thanks for coming onto our live stream. I appreciate you joining us live. All right, next question. Do I wear the knee sleeve while walking? Now, this is a great one because we recommend walking for certain situations. If you've got your glutes working right and you can use them while walking, then walking is a good thing for you to be doing if you're dealing with knee arthritis, bone on bone knee joint situations. So you've got to first go back and see if your glutes are working right before you go walking. Don't take my advice right now is walking is great for everyone with knee arthritis. There's some prerequisites that you have to meet in order to be able to go walking and it help you out in your knee arthritis situation. But just like with exercise, wearing a knee brace during walking is optional. If it feels better to do so, then go for it. If it does not feel better to do so, then stop doing it. It's not a requirement. You're not going to necessarily get worse. What people will typically complain about is during walking and right after walking with their knee pain, it's due to the root problem, the muscle imbalance. Usually they're overusing their quad muscles, the muscles in the front of their thigh during the walking, and that's what's causing the pain. If you can fix that, then you're going to be able to walk better and help your knee situation out simultaneously. The brace is not going to necessarily make the walking better, but some people feel that it helps them out, and go for it. If it doesn't get in the way, put it on. That's okay. Sherry, you're asking a question. How do you feel about cortisone shots in the hip for OA as an option for waiting for hip replacement? Great question. Let me answer this right now since it's kind of not related to the knee stuff, and I'll come right back to the knee stuff. If I'm okay with cortisone shots in the knee and the hip, as long as it's not your main plan to deal with the arthritis. You've got to deal with that muscle imbalance, just like I was talking about. There's a muscle imbalance likely in your hip, Sherry, that's causing you excessive pressure in your hip and probably your knee joint if it hasn't already affected it. It may later on. And a cortisone shot does not affect the strength balance around your hip and knee. So if you're going to get a hip injection, then go for it. It might help you sleep better. It might help you to just live your daily routine better, be able to get through life. But you need to have a plan to treat the root problem because a cortisone injection is not going to fix the root problem. And then also there's a danger in taking too many cortisone injections. Typically doctors will limit you to 3 or max 4 per year because it does break down your ligaments, your cartilage, any connective tissue in your body. Cortisone is known to damage it over time. So you got to be careful when it comes to getting too many cortisone injections and that being your main plan to treat your hip arthritis. Hope that helps, Sherry. All right, let's come back to number 4 for when to use for how to use a knee sleeve or a knee brace. Should I wear it when sleeping? This one is asked probably the most of all the questions. And it goes back to like the exercise and the walking questions that I answered earlier. It's up to you. If you feel like you sleep better at night wearing a knee sleeve, then go for it. Here's the thing. Some people have a routine when they go to sleep because their knee arthritis bothers them. It keeps them from falling asleep, or it might wake them up in the middle of the night. And if you can figure out a routine that works for you to get the best sleep during your situation dealing with your knee problem, then that's what you want to go with. And if a knee brace is part of that, a knee sleeve, then do it. I've had several patients that say that they'll massage their leg muscles at night, what by hand or with some device like one of these sticks. They'll rub the muscles out, or the percussion gun, the thing that looks like a drill, and it goes back and forth really fast, and they'll go over their muscles. They'll do that for 5 or 10 minutes. Then they'll rub a pain cream on it, like Icy Hot, Ben Gay, Tiger Balm, one of those. And then they'll put on their knee sleeve over that. And when they go through that routine, that 15, 20-minute routine, then they feel like they can go to sleep and get good sleep. If you're in that situation or some version of that, put on a knee brace, put on a knee sleeve. And if you can sleep like that, then fine. Now, if the knee sleeve gets uncomfortable for you, then take it off in the middle of the night. If you can still sleep after that, great. If you can't fall asleep or that knee sleeve is just too uncomfortable at night, then don't wear a knee sleeve. There isn't a hard and fast rule when it comes to wearing a knee sleeve at night when sleeping or not. It's really an optional thing for you. Thomas Tripoli, hello. Hi, David. I just finished the knee course. My knee feels much better. I'm going to continue the exercises. Awesome. That's great, Thomas. Thanks so much for commenting on that. And just a quick plug for our 28-day knee health and wellness boost program. That's what Thomas is commenting about. It's a 100% online and on-demand program, so you can access it anytime from anywhere you have an internet connection. And this program is designed to help you fix that muscle imbalance that I've been talking about. We spend a lot of time talking about the glutes. It's exercises that you're guided through, as well as my advice and coaching throughout the whole program. And you can repeat the program over and over to continue to maximize your benefits. So if you're thinking about joining that program, I'll drop a link in the description here, and you can definitely consider signing up for that program to get a solid plan on improving the root problem of your knee arthritis. I'll come back to the next question. Let me stay on track here. Thanks for mentioning that. I appreciate it, Thomas. All right, we're halfway through. So we're on number 5 now. So just to review, number 1 was, should I use a knee sleeve with or without hinges? Number 2 was, should I wear it while exercising? Number 3 was, do I wear the knee sleeve when walking? 4 was, should I wear it when sleeping? Number 5 is, when can I take the knee brace off? This is a huge question we get. Now, all these questions are super common, but people will always ask, do I take it off when I shower? Do I take it off when I go to sleep? And absolutely, because it's not a required thing to wear, you can take it off whenever you want. You can put it on whenever you want. Generally, you're going to wear it when you have pain, which I'll talk more about in the next question. But as far as when to take the knee brace off, slide it off whenever you can. Now, they're sometimes difficult to put on and take off, of course. So you have to plan it out. You know, if you're going to wear this under or over your clothes, typically people wear them under their clothes. So you might have to put it on while you're getting dressed for the day. But there's no hard there's no hard a reason for you to keep it on or take it off except pain. Let pain be your guide when using this. So on that note, let's go into the next one. Number 6 is, what's the schedule for wearing the knee brace? People always ask that, like, do I put it on first thing in the morning, or when's the right time to wear it? When do I take it off? So there's no solid schedule. If you feel pain, then that's when you should use it. I would equate using a knee brace or a knee sleeve for bone-on-bone arthritis, because it's different for a ligament problem. I would equate it with using it like you would use pain medication. So if you're thinking of taking ibuprofen or Tylenol because your knee's hurting, try slipping on a knee sleeve or a knee brace and see if that takes the edge of your pain off. It might be enough relief that you don't need to take pain medication, or maybe you need to use both in combination. You get a combined pain relief effect. You've got to experiment and see what works best for you. Some people feel more pain and discomfort in the morning, especially with arthritis. That's common. You know, if you've been sleeping all night and then you get up, you're typically very stiff in the morning. So it might be a great idea to get that knee brace on as soon as you can in the morning after as you're getting ready for the day. Some people get worse as the day goes on, so you might avoid wearing it in the morning if you feel fine. That way it's not impeding your movement, if that's a thing for you, and then get it on in the afternoon or the later part of the day, so that you can tolerate the rest of the day. Some people wear them conditionally, like if you know you're going to be active that day, like if you got a lot of chores or errands to do and you're going to be out going to the store and you'll be on your feet for a while, or you'll be in the house taking care of laundry, cooking, those kinds of things, then you might decide to wear the brace more that day, because it helps you feel better at the end of the day, versus if you know you're going to have a bad day with your knee because you're going to be busy, wearing the knee brace might take the edge off a bit. If you're going to be relaxing at home and you're not going to be on your feet a lot, or maybe you have a job and you're working sitting most of the time, you're not going to be on your feet a lot, then you may choose to not wear the brace at that time and you might be just fine. So the schedule is really determined by you and when you feel you need it based on your pain and discomfort. The one piece of advice that I can give you is try to stay ahead of the pain. In other words, if you know that you're going to wake up with stiffness and pain in the morning, before you get up and move around, get the knee brace on. If you know it's going to bother you right before you go start doing your chores, put it on before you do your chores. That way you're not already feeling bad and then having to put it on. So I hope that helps. Let's go on to, oh, we got some comments here. Okay, Dick and Worsley, how about using Ktape around the knee? Great question. Kinesio tape, otherwise known as Ktape. It's known to mildly help, and I think it could be an alternative to using a knee brace. Some people prefer that. It's a little lower profile. I have some right here, in fact. So they come in different colors. It looks like this. It's not very stretchy typically. It's kind of rigid. And it sticks on for a while. And there's different types. There's some that stick on for just a day. There's some that stick on for like a week. You would shower with it and everything and just let it fall off whenever it falls off. And some people report a lot of benefit with it, and others say not really much of a difference. Just like with knee braces, same thing. Some people put on a knee brace and they say, you know what, I think it's a waste of my money. And other people say, this is great. I'm so glad I found this. This is going to take me away from ibuprofen. So I'd say give it a shot, Dickon. It really depends on your situation. As far as putting it on, there's a ton of different ways to put it on. There almost isn't a wrong way to do it. You can experiment and find out what's best for you. So there's tons of videos out there. I don't have any in our library here of videos. We'll have to get those going eventually, but at this time we do not have any. So best of luck to you in finding out if that works for you or not. RC is the next comment. I'm a newbie and just learning about the correct way to go up and down stairs has helped my knee pain. I plan to watch more and improve my knee pain. Awesome, RC. Great for you. I'm so happy that you found some relief. Yeah, that whole stair climbing video that we've made has helped a lot of people. We've got tons of great comments on there. And the focus of it is using your glutes. That's, again, addressing the right problem, the root problem of most knee issues, knee arthritis being one of those for sure. So congratulations. Check out our videos. Drop comments on there if you have any questions, and we'll get back to them as best as we can. All right, guys, I've got just a few more minutes, and then I have to skip out of here to start treating patients for the day. Last question. I've actually got some bonus questions, so stick around just a bit more. So we're on number 7 now. When do I end wearing a knee brace for bone-on-bone knee arthritis? In other words, how long do I wear it? Do I wear it for 3 months, 1 month, for a year, for indefinitely the rest of my life? This question comes up all the time, and I love this question the most because there's so much variability in what healthcare professionals say. You know what? Most of the time they don't say anything. They just say, "Oh, hey, buy my knee brace and just wear it," and they just leave it at that. And I disagree with that. I think there needs to be a plan. You need to have a strategy for what you need based on your knee situation. And here it is. If you've got severe bone-on-bone knee arthritis, like you've been to the doctor and they said it's severe, and you've got losses of motion, like you can't fully straighten out your knee. Got a knee joint here. You can't fully straighten out your knee. Your knee stays kind of bent like this, or you can't bend it all the way. You've got a block this way. You should be able to bend your knee like to here, but it doesn't bend, and it's lessing your other knee. And you know that it's severe. You've got x-rays, you've seen the doctor, and they're recommending that you probably get a knee replacement soon. Then you might decide to wear a knee brace indefinitely in that situation. If you are severe and you go get a knee brace or a knee sleeve and you slide it on and you find that it helps you, you actually can move around better. You're not as bad at the end of the day. It's becoming more tolerable. And I would use this in conjunction with treating the root problem, like I talked about in the 28-day program, or going up and down stairs, like RC mentioned as well. You've got to make sure that you treat the root problem. But if you find that the knee brace helps you, then you might be able to push that knee replacement out. You might be able to delay on doing it so that it gives you a chance to get healthier in case you're going to do it anyway. Or maybe you can get better enough to where you feel you don't need a knee replacement because you don't want to take that risk. That's cool. But if you're in that severe category, then you should probably wear that knee brace indefinitely. It might just be the thing that you wear the rest of your life when you're busy, when you're on your feet more. You might take it off at times that you feel like you don't need it, but you might just wear it indefinitely. Now, if you're more mild or moderate, if you had an x-ray and your doctor said, you don't really need a knee replacement right now. Yeah, you've got knee arthritis. There's a couple spots that are bone on bone, but you'll be okay if you do the right things. Then you should probably look at using the knee brace temporarily with the plan that you're going to be fixing the root problem of getting your glutes stronger, getting your foot muscles stronger, treating the root problem. You might need somebody to help you loosen up your knee joint a bit so that you can get more effectiveness out of your exercises. You can get more out of your exercises. But if you are in that mild to moderate zone, your knee arthritis is not that bad, then what I would strongly encourage you to do is to wean yourself off this brace. As you get stronger in the root problems, in the root muscle imbalances, the glutes and the foot muscles, then you should feel like your knee is getting better and not need to rely on this. The harm in relying on this without a plan of treating the root problem is that your knee might like it too much. In other words, your muscles are smart. They figure out when they get support from the outside, they don't need to work as hard. If you're relying on the knee brace and not addressing your glute strength, your foot strength, then you might potentially get weaker in the glutes and feet over time, which is going to feed into the main problem and make your knee arthritis worse over time. And I have met people that feel this helps them out, but then after a while it stops helping them out. And the reason for that is because they never addressed their glute strength or their foot strength. So you can use it, of course, but wean yourself off of it if you're in the mild or moderate zone. And as far as the time frame, it varies. It might take you a month, it might take you 6 months or a year. It really varies on the individual and other factors. Weight could be an issue, how often you exercise, how fast you progress in your strength, your age, the severity of the knee arthritis. If you're more mild, well, it's going to take you less. If you're more moderate, it might take you more time. It really varies. So I hope that helps with understanding when to stop using the knee brace. If you have any questions, drop the questions in the comments below. Now, let me give you 2 bonuses here, and then we'll wrap up. If you have any questions, drop them in now. I've been answering as I go along. We'll try to continue that. All right, bonus question number 1 is, how tight should the knee brace be? How should it fit? It really is just a comfort thing. So it shouldn't be so tight that it's cutting off your circulation, causing numbness, tingling, or itching excessively around the fit of the brace. But it should be tight enough to where you feel a difference in your knee situation. It shouldn't slide around either. If it's starting to slide down your leg, then it's not tight enough. And that you might need to troubleshoot through this, by the way. So there's some knee sleeves out there that don't have any straps. Like this one's got straps. So that's going to make it more secure. But if your leg is more slender, it's almost as even in the thigh as it is in the calf, then a knee sleeve might be better for you. If you're more tapered, in other words, your thigh's bigger and your calf smaller, then getting a knee brace with straps is probably going to be better, so you could cinch it down on your leg. Knee braces are made generally one size fits all. They'll have small, medium, and large. Like this knee brace that we've got here, it's the Shock Doctor brand, and we've got a link in the description below. It's generally a straight brace, so it's not that much wider at the top. It's for a straight leg, but I like the straps on it because it can adjust for a tapered leg where the calf is smaller than the thigh. So that way you can get it to fit, but it's going to slide down anyway. It's just a matter of finding the brace that slides down the least. So you got to get the right fit. Now it's going to be kind of snug when you first put it on. The newer braces obviously are tougher. Once you kind of break it in, then it'll slide off and on easier. And the materials do loosen over time. So you might consider getting a new knee brace if you're going to be wearing one for a while from time to time. Now, generally, as far as the cost, the more expensive knee braces have better materials, they're built better, so they last longer. So you pay for what you get usually. The cheaper knee braces, they don't last as long typically. The seams start to fall apart. They start to smell for longer amounts of time as well. So it really just varies on how much you want to spend. And then Okay, so the last question I have, sorry, I just thought of another question I want to give you. The next question, because I'm going to give you another bonus question. How can you tell the knee brace is working? You can tell the knee brace is working within a day of wearing it. If you put it on and you're thinking, I don't know if it really works, I didn't really feel much of a difference. A day goes by, like from when you wake up to when you go to sleep, then I would say it probably is not going to work for you long term. If you want to try another couple of days, then go for it. You don't have anything to lose. But you should feel like it takes the edge off of your pain. Now, let's talk about expectations when how much it's working. Many times people are expecting the knee brace to take away your pain 100%. And that's just is not the reality. I've never seen anybody slide on a knee brace and say, my knee pain's gone. Oh my gosh, I wish I would have found this last month or last year, depending on how when their knee problem started. That never happens. What you're more likely going to expect is for the knee brace to take the edge off of your pain 10 to 20%. That's it. Just like some pain medications just take the edge off but don't take the pain away completely, especially the lower strength pain medications. That's about what you're expecting using a knee brace. If you get more than 10 to 20%, then you're lucky. If you can get a 50% or more improvement, you're in the minority. From patients that I've seen, it's rare that I see patients say, wow, this knee brace makes the world of a difference. It does happen from time to time, so that might be you. You're lucky if that is you, but more commonly expect a 10 to 20% improvement. And that's good. That's what you're looking for with a knee brace. Okay, the other question that I get, the one that I just thought of in addition to the other bonuses is, does the copper brace work? I've got a whole video talking about this, and I'll just give you the gist of it, but you can go check out the details if you want. We've got a playlist of all knee brace videos, which I'll link in the description. But that copper brace, there's nothing magical about the copper besides an antimicrobial or antibacterial effect. So basically, the knee brace is just going to smell less from wearing it because knee braces get sweaty, they start to smell. But the copper has an antimicrobial or antibacterial effect on your sweat and your other stuff that comes off your leg. So that's the only effect that you're looking for. There's nothing magical about copper as far as making the arthritis go away or reducing pain. It's just for cleanliness, for odor protection. So I hope that helps. I didn't get any other questions on here, so I'm going to start wrapping up here, guys. Thank you so much for all of you that joined us live. Again, if you're catching us on the replay, thanks so much for joining us on this video as well. If you have any comments or questions, drop it below and give us a thumbs up as well. Let us know if you like this video. It helps us to get seen more on YouTube. Y'all have a wonderful day. Bye-bye.